I'm Dr. Jason Clain. I'm a Harvard-trained, board-certified plastic surgeon with New York Plastic Surgical Group. I have known that I'm going to be a surgeon since I was 12 years old. After college and before medical school, I spent 2 years working for a head and neck cancer surgeon, seeing how people who had lost massive pieces of their head and neck had that put back together. So I went to medical school knowing I wanted to do something, probably up here. And as I progressed through medical school, I fell in love with plastic surgery. The whole way through, I knew I was going to come back to Westchester and practice where I grew up. But really, my training started a long time before that. When I was 14 years old, I started working on an ambulance in Greenwich, Connecticut, and I started as a volunteer, and I started doing 911 calls. And so I basically took people from the Merritt Parkway, from I-95, facial injuries, body injuries, to level 1 trauma centers. And so that was the introduction to medicine. I had 2 parents in medicine who loved being doctors. And so I always knew I was going to medicine. I always knew I was going to go into surgery. And then as things kind of ticked along, I always tried to seek out the most challenging experiences to become the best at what I could do. I focus mainly on the face, and I do both the aesthetic side, which is eyelids, noses, and facelifts, and then I also do the reconstructive side. So you'll always find me operating pretty much on the same parts of the body. Sometimes it's to bring back the person to a decade earlier. A facelift, bring back a decade of age. Sometimes they're missing a piece of their nose because they had a basal cell carcinoma. Same goal, bring back what they had before. I am especially passionate about delivering results that are consistent and vetted. I always tell people I'm a medium adopter. They always say the most dangerous time to go to a surgeon is right after they get back from a conference because everybody's thought of all these new ideas and they think, oh, I got to do all these new cool things. The truth is I like to be somewhere in the middle. I want someone else to have tested a procedure before. I want it to work for 3 to 5 years, and then I'll bring it into my practice. I'm not gonna be the first person trying something out on you, but I'm also not gonna be the last person. So things that I'm really passionate about are deep neck lifting, deep structural lifting of the face, doing upper blepharoplasties in a good harmonious way. Sometimes that means you need a brow lift at the same time, but really thinking of things holistically. Everybody wants a natural result. Anybody going to a good plastic surgeon should get a natural result. For a facelift, if somebody wants to see what a natural result would look like on them, it's very simple. You get in bed, you take a mirror, and you lie down flat, and you look in that mirror, and you look at all those structures of the face as they redrape. That's a natural facelift result. It's just bringing everything back to where it was before. Now, when you stand back up, that all falls down. But if I do it, when you stand back up, it all stays where I put it. But it's the same thing. So that's a natural result. Picking the right procedure for the right patient is absolutely critical. And so the first thing I always do with every patient is I hand them a mirror and they have to tell me their number 1 and number 2 concerns. If something bothers you and there's a great surgical solution, let's do it. But I'm just as comfortable saying, let's wait to a patient. And honestly, that's the hardest discussion that I have because they think I'm holding something back. I don't want to go through all this surgery and then at the end have somebody who says, I guess I see a change. That's not enough for me. The single most rewarding thing is when we have a happy patient, whether that's a facial aesthetics patient or a reconstructive patient. I would say there is a patient who I went through for a very long time who was missing a large piece of her nose from a skin cancer. She's very young. We did a forehead flap reconstruction, and these, I tell people, are gonna be 4 or 5 surgeries until we get it right. And with each stage, she got more and more concerned that, is this really what it's gonna look like for the rest of my life? And it's little incremental changes. And finally, we did the last stage, added some cartilage, thinned things out. She came back to the office, we took off the dressing, and she cried out of happiness. A happy patient is as good as it gets. Honestly, most of my happiest patients come from other patients who have already met me or other doctors who already trust me. Because there's an inherent trust there, right? If you trust your dermatologist and you've known them for a decade and they say, go see this guy for your facelift, there's a trust there already. So if you're considering a procedure, start your journey with somebody's plastic surgeon who made them really happy, because that's at least a really good place to start. What I'm most looking forward to in the future is just continuing to grow and to grow a team. It's really important to me to have happy patients, but also there's no way I could do this without the team that's here with us every week. We have physically moved boxes from office to office until we got into this beautiful space. So I really want to continue to meet more patients, make happy patients, and grow a team. I love coming to work and having people feel like we are all on the same level and we all are trying to achieve the same common goal. So I currently see patients in both Westchester County and Fairfield County. We have offices in Harrison and Stamford that I see patients in. So I'd be happy to see you in either location. I love to meet people either in the office or virtually. And it's really easy. The first consult can just be a get to know each other. We can go over some things that are bugging you and we can basically figure out what are the next steps.